Namaste everyone. Well, today we are doing back-to-back Insta sessions. We have a very interesting topic right now on difference between yoga and yoga therapy. I don't think a lot of us know between the difference between the yoga and the yoga therapy, but we're going to have Jamie Driver who's going to join us from Healers and Protectors and tell us the difference between the yoga and the yoga therapy. How many people know what the difference is between yoga and yoga therapy? People who are joining us. So she will be joining me in 1 second, and then we will be talking to her. Her has been a yoga therapist for the last 15 plus years, and she'll just, oh, there you are.
I did not need to invite myself, so I'm here now. Yes.
Great to see you. And I think today is a great day to be talking about difference between yoga and yoga therapy. I think all of us in US need a yoga therapy today with watching the elections and all of us kind of getting a burnout watching the same thing. So it's a perfect topic.
Yes. Let me get adjusted here since I've got a little height difference here on the camera where I thought I was going to be. Yes, absolutely. And we can talk about that. So I just want to start by, like you mentioned, describing the difference between what most people think of as yoga and what yoga therapy is about. So yoga therapy is healing centered. That is the intention behind it at all times, is healing. And I think what most people think of as yoga now, especially in the United States, is a group fitness or individual fitness type of practice. And maybe at the end of that, you become enlightened, right? So it could be that you're just in it for the physical benefits, or maybe that you think that you will reach some sort of spiritual pinnacle. And when we talk about yoga therapy, again, it is healing centered, and it comes from the idea that we are all getting knocked off balance all day, every day, for one reason or another. So really the intention is, how can we become more balanced? And that's going to differ from person to person based on many different factors. But again, most important point to understand is that yoga therapy is healing centered. So what would happen if you were to practice with a yoga therapist, to consult a yoga therapist, is that they would first do an intake session with you. And in that intake session, just like anything else, they would ask you, your medical history, what's going on, what's your presenting issue. But there would be a lot of other questions on there that you might be surprised to hear. Questions about like your fingernails, for example, or the types of foods you've been eating, the types of foods that you're craving. So normally when you go to a counselor, as in the psychological therapist, they might not ask you what types of foods you've been eating, because their domain is of the mind. But in yoga therapy, we understand that the mind and body are completely connected, and what you're consuming through all of your senses will have an effect on what's going on in your mind, and vice versa. The impressions that you're taking in through your eyes and ears and through the processing of the mind will have an effect on your body as well. So it's really the most holistic, comprehensive way of healing all sorts of issues in the mind body. And that's what's also great about yoga therapy, is you can use it simply for something like digestive issues, but the types of actions that you would take to heal those might not have to do with the food that you're eating. It might have to do with something else going on in your environment. Or it may be, again, that we're working on something with the mind, but to get to the mind, we're going to work through the body. And so it's really this feedback loop of understanding how both of these parts of ourselves that we consider as separate are actually interrelated and the whole. So yoga therapy is an intrinsic part of yoga therapy is Ayurveda. And I know on Nourish Doc, you talk a lot about Ayurveda. And for people that maybe are unfamiliar, the simplest way I think we can describe Ayurveda is understanding that everything in life, including our bodies and minds, can be categorized under the different elements. So earth, water, fire, air, and ether. And everything in existence is a manifestation of at least one of these elements. And our bodies are also manifestations of these elements as well, and our minds. We're born with certain predispositions towards certain elements, and based on many, many, many different factors, such as how old we are, what season of the year it is, what time of the day it is, and again, many, many, many other things, we might be not just a little off balance here and there. So as again, it's very, there's a lot that goes into it, and to become a certified Ayurvedic practitioner takes years. So the simplest understanding though of this is maybe you're born with a lot of fire. And so what we say in Ayurveda is like seeks like. So you're born with a lot of fire, you crave fire, you want more fire, but what actually would be more balancing for you would be maybe some water or maybe some earth. And so how are we looking through the lens of these different elements to create balance in the mind and body, and what does that mean? So using the example of fire, for example, fire is the sense of sight. And another way of looking at that would be violence would be a fire element. Yeah. So if you are watching violent TV shows, you're adding fire to the mind body through the sense of the eyes, right? And so if you have a fire imbalance, it may be that a yoga therapist would ask you, you know, a bunch of different balances could be made. But if one of the things you're doing is watching violent programming, then we would ask you to maybe cut down on that.
Got it. So
right?
Everything, you're going to ask a person everything. And what are your tools? Like your tools would be breath work, meditation, asanas. I mean, how would
right.
you?
So then that would be an example. So again, let's say you have a fire imbalance. So that would be one aspect of it, is how do we treat the mind?
Yeah.
And then working with the body itself, we would do cooling, grounding practices, right? So what would balance fire would be cooling and grounding. So cooling types of breath work and grounding types of body work. So a person that is born with a lot of fire might gravitate towards a vinyasa practice, a really fast yoga asana practice where there's a lot of movement and you're building a lot of heat, because that's what they're gravitating towards. But what actually would be more balancing is a restorative practice. So instead you would be lying on the floor in a dark, cool room, holding the shapes for long periods of time, taking deep, cooling breaths. And although it might not in that immediate moment feel the most comfortable because it's not coming to you the most naturally, that's actually going to create more balance in the mind body, and therefore it becomes more healing.
That makes sense. That makes complete sense. The way you described it is very beautiful. Very simple way you described the whole thing, because people get so confused. I mean, including me. And I see people joining, and you're welcome to ask questions or feedback and comment. You know, this is an interactive session, so people are welcome to comment if they want to. So let's talk a little bit about, you know, you specialize in the stress, is what my understanding is. Is that you specialize in that? Is there any specialization that a yoga therapist would do? Or it's like, if I come to you for digestion, you can help me. If I come to you for stress or burnout. So does that concept exist for yoga therapists or not?
So what I specialize in is trauma-informed yoga therapy. The certification for yoga therapy is certified through the International Association of Yoga Therapists. And while there are courses that you take as part of that programming that put a focus on trauma-informed yoga. At this time, there isn't necessarily a certification that says that you are a trauma-informed yoga therapist. However, there are very simple, just trauma-informed yoga courses through all sorts of different programs and teachers. Hala Corey was one of the people that I worked with out of Off the Mat into the World. Also a great training in and of itself. And I specialize in working with frontliners with PTSD. So we can look on a spectrum of the stress response to trauma, right? So we're all having our stress response activated for whatever reason all day, every day, just living in 2020. If you live in a city and you have to cross the street and someone is not stopping at the crosswalk for you, you know, it might activate the stress response a little bit. Or you get an email where you forgot that you had an assignment due and the stress response is activated. And then on the other hand, you have traumatic experiences, which I will say are determined by the perspective of the person experiencing them. But the intensity with which that stress response is activated within the nervous system, within the brain body, is a little bit different. So it causes the body to really go into hyper arousal or hypo arousal. So far on opposite ends of the spectrum, as opposed to kind of being regulated in here, and maybe it's a little stress response either way.
Yeah. So let's say someone comes to you who's had a traumatic like PTSD. Is there some kind of a diagnostic test that yoga therapists would do, or is it only like through the intake form you'll ask me, what my trauma is or what anyone else's trauma is?
I think that it is, again, part of a relatively long assessment is to go through and see the intensity of symptoms, but also just from a general therapy standpoint, what we usually like to do is validate people's, personal assessment. If someone says that they're traumatized, then they must be traumatized, right? So, rather not people that are kind of overgeneralizing with the word and they know that, but if someone is seeking treatment for trauma, then we work with that and we use whatever different tools are appropriate for that individual. And again, that does vary from individual to individual.
Sure. And there's a lot of research and science that validates that yoga therapy, I should say, that effectiveness of yoga therapy for trauma, stress, and other things, right? I mean, that's at least what I have seen in PubMed and some of the other. There's been a lot of clinical trials that have proved yoga therapy to be very effective.
Right. So I would recommend, if anyone's interested in that, to again go to the IAYT, the International Association of Yoga Therapy website. They have a lot of resources if you're interested in different studies for all the different ways that yoga therapy can be used. But as far as what's become a little bit more mainstream, most people now in the wellness world are familiar with Dr. Bessel van der Kolk's book, The Body Keeps the Score. He mentions yoga therapy or yoga as therapy for trauma a lot in that book. Through an organization that's affiliated with his center, the Trauma Justice Institute. David Emerson is the leader of that program, or has been the leader of that program, and he's written a couple books on trauma-informed yoga, and one of those being a book that is specifically for therapists. Even if you are not trained in yoga, it can help you understand from the mental aspect of therapy how yoga can be used for when we talk about stress or trauma, and what's effective and why. Gives a really good kind of like general overview and incorporates a lot of that research too.
Great. So tell us, before we wrap up, if you don't mind, like one breath work for cooling technique. You talked about the cooling techniques and restorative yoga. So maybe you can tell our viewers one asanas or one breath work that they should do, something very simple.
Yeah. So when we're talking, I think right now, what's useful to understand when I explain that the types of yoga therapy techniques that would be used are vary from individual to individual. We go back to that understanding of the stress response and how people can go into either hyper arousal or hypo arousal. So other more common words for that would be towards anxiety, like high anxiety, or towards depression, numbing out, lethargy. And so the types of techniques that would be used would depend on how you're feeling in the moment. So if you're feeling kind of numbed out and you're moving towards hypo arousal, you could actually benefit from stimulating practices. So you would be doing stimulating types of breath work, of pranayama, to bring heat into the body.
Pranayama. Yeah. So there's a comment. I was just trying to read that. What are what is the main difference between yoga therapy and somatic experiencing as a practitioner and client?
Yeah. I would say that if you're working with a yoga therapist, and again, you're taking into account all of the Ayurvedic stuff too, yoga asana, if you're working with a yoga therapist doing yoga asana, there are more formulated shapes that you will take in an asana practice. So everyone might be familiar with, for example, tree pose, right?
Yeah.
So you do tree pose, you're standing on one leg. That's a shape that from person to person, working as a client or a facilitator, we all know tree pose, right? Somatic experiencing and somatic expression, I think, is more intuitive. And when you're working as the client or with the client, there might be movements that occur that don't have a name, right? So you're doing this. There's not a name for this, but that's what feels good for you to channel whatever's coming through as you're releasing the trauma. And then working from the practitioner standpoint, there's a lot of different somatic processing techniques. But you would be guiding your client or patient into that understanding of like, what type of movement do you want to make that would feel good, that would make sense based on what's going on in your body mind.
Okay, hope that answered the question. I forget the name of the person who asked because it's going pretty fast. So any other comment and feedback before we wrap up? So we were going to wrap up with, please go ahead. Yes.
Yeah, to touch back on what is really important for people to understand again about the individual types of treatments for stress, burnout, trauma, is that it's not always a one size fits all. It really depends on what's going on for you based on your developmental programming. So how is your nervous system shaped as an infant, as a child? What's going on for you in the present moment in your external life, and then what's going on internally. And again, it's very oversimplified to say this, but it may be that you again are more towards numbing out and more towards hyper arousal. So the balancing factor there would be adding more heat, adding more movement and mobilization. Or it may be that you are hyper aroused and you have a lot of movement, you have a lot of fire or air, there's all different words we can use to describe this. But so what would be more balancing for you would be more grounding, more stillness, more coolness. And so working with a guide is really important because they're going to be able to help you understand what's balancing, and they're going to also be able to help you understand the amount of work that you need to do, right? So if you're really, really hyper aroused, like right now, people feeling really, really hyper aroused and really, really stressed, also depending on your history, it's really easy to say, well, you should meditate for 30 minutes, or you should do an hour and a half restorative practice. And for some people, depending on like how far off balance you are, being asked to sit completely still and to hold those shapes or to meditate in place is not going to be helpful. although we would think that that would be balancing, it needs to happen at a little bit more slower pace, right? So maybe instead of, if you're really, really hyper aroused, we wouldn't ask you to sit still for 30 minutes, maybe just trying 1 minute. 1 minute of mindfulness is going to be balancing. And maybe we do that at 5 points throughout the day, for example. So that's why it's really important to work with people that are trained, that know all of this information, because what we don't want to do is accidentally re-traumatize someone or send them off in the wrong direction when they're trying their best to find that balance.
Sure. No, that makes complete sense. So do you think you could tell us one breath exercise for calming ourselves in today?
Yeah.
Yeah.
Super, super simple. If you want to activate the vagus nerve, which creates the calming response in your nervous system and the parasympathetic nervous system, you just make your exhalations longer than your inhalations. So it may be that you inhale for 4.
Okay.
And then exhale for 6.
Just simple inhale, exhale, 4 and 6.
Yeah.
That's it. Oh.
It doesn't have to be complicated. And it doesn't have to be 4 and 6 either. If you're, again, it depends on how you're feeling and what your breath is. Maybe if you're having a panic attack, right, and you're breathing like this, maybe it's, you just make the exhalations longer than your inhalations. And it's okay to do in through the nose and out through the mouth. It would be great if you could work towards in and out through the nose. We always want to take the breath down into the belly. Really important that we get it into that diaphragmatic breathing and not the upper chest breathing. But yeah, maybe you inhale for 1, exhale for 2. Maybe you inhale for 10 and exhale for 15. And you could be starting at one end and then work your way up to it, right? So for a minute, if you're in a state of panic or high anxiety, you're inhaling for 1, exhaling for 2. Maybe the next minute you inhale for 2, exhale for 4, and you can keep working with that until you're able to downregulate through the nervous system. Yeah.
So that's very helpful. And then people also do anulom vilom, like an alternate nostril breathing as well too. I don't know if that helps with the stress, but at least people talk about that. What's your view on that? The alternate nostril breathing?
Yeah, I mean, alternate nostril breathing, it also balances the different hemispheres of the brain, which is really healthy. It's a really great maintenance tool, I think. I think if you are very new to the practice, that it might feel odd and awkward, and it might create more anxiety. So I don't always start out with that one if I'm trying to introduce people to breath work, because that they're like, all right, what is this? But there actually is a lot of research for alternate nostril breathing as well. And even just like a simple Google Scholar search will show that. That is because there is lots of great evidence-based work coming up around that, which is exciting to see.
Great. Well, thank you so much. This was an amazing, amazing session. I think it's so much needed for all of us during these times. And we'd love to have you back on, some bite-sized another topic. Any questions and feedback anyone has, you're welcome to send us your feedback. Our Instagram account or our email, care@nourishdoc. And anything else you want to add before I wrap up?
Nope, just may you be well, and I hope everyone is setting aside time for self-care right now, and just remembering that it's really important to give yourself that spaciousness and self-compassion for whatever's coming up.
Thank you so much for joining us. With that, I'd like to wrap up the session. Thank you.
Okay. Bye.